Good morning and welcome to Face the Nation. Margaret is on maternity leave. The country appears to finally be turning the corner on the pandemic, and there is good news to report. 1/3 of American adults have been fully vaccinated. Children between 12 and 16 will likely be able to receive the Pfizer vaccine soon. And there are drops in every way we measure the virus: new cases, hospitalizations, and deaths. But we're still having trouble rounding the bend with the economy, as that disappointing jobs report made for sobering headlines Saturday and reminded us that the road to recovery is going to be a long and winding one. And we've got a lot to get to today, and we're going to begin with former FDA Commissioner Dr. Scott Gottlieb. He sits on the board of Pfizer, and he joins us from Westport, Connecticut. Good morning, Dr. Gottlieb.
Good morning.
So every time we talk about where things are, and then you kind of tell us where we're going to be. A few weeks ago, you were saying, they should change the mask restrictions for outdoors if you're vaccinated. You're feeling now about maybe changing those mandates for indoor masks. You think they should be lifted, do you?
Well, look, COVID won't disappear. We're going to have to learn to live with it. But the risk is substantially reduced as a result of vaccination, as a result of immunity that people have acquired through prior infection. And so I think we're at the point in time when we can start lifting these ordinances in a wholesale fashion. And people have to take precautions based on their individual risk. They have to judge their own individual risk and decide whether or not they're going to avoid crowds or wear masks based on their circumstances. But we've always said from a public health standpoint that we would set as a metric maybe when we get down to 10 cases per 100,000 people on a daily basis. Well, half the country's there right now. If you want to be more conservative and say 5 cases per 100,000 people, well, by this week, probably about a quarter of states will be there. So we're at the point right now we could start lifting these ordinances and allowing people to resume normal activity. Certainly outdoors, we shouldn't be putting limits on gatherings anymore. We should be encouraging people to go outside. And in the states where prevalence is low, vaccination rates are high, and we have good testing in place, so we're identifying infections, I think we could start lifting these restrictions indoors as well on a broad basis.
When you talk about people's individual risk calculations, those have been all over the place. One of the things we've seen in these economic numbers on Friday was that people are still scared. Help people understand how they should think through making their own risk calculations after more than a year of kind of stabbing at trying to get some clarity to decide how to keep themselves safe.
Well, look, I think part of the hesitation right now is cultural. We have spent a year apart. We've spent a year being told to stay away from people and wear masks. I think it's going to take some time to get back in the normal swing of things and get that socialization back. But if you've been vaccinated with the mRNA vaccines or the J&J vaccine, your risk is very low from having a bad COVID outcome. And your risk of getting an asymptomatic infection that you could spread to others is also substantially reduced. The data now does support that. So we could start drawing some firm conclusions and basing up public health advice on that. There's one model that's out that says that if you were 65 and above, your risk of succumbing to COVID if you were infected with it was around 1 in 100 during the peak of the infection, and probably a little worse than that at the outset. That same model now predicts it's about 1 in 20,000 if you've been fully vaccinated and you're an immunocompetent person. So the risk is substantially reduced from vaccination, and I think you can sort of conclude that probably your risk from COVID if you're fully vaccinated is comparable, maybe even less than your risk from flu if you're fully vaccinated in older individuals. So, you can start resuming normal activity. I think the only residual risk for someone who's fully vaccinated is, could you have asymptomatic infection that you don't know about? And if you're around someone who's immunocompromised, is vulnerable to COVID, you still want to be careful in those circumstances. But when you're in those circumstances, and you always want to be careful in those circumstances because you don't want to pass an infection to someone who can't defend against it.
So is it fair to interpret what you're saying is that if I've been vaccinated twice, even if I'm in an elderly population, that essentially the risk for me, I shouldn't think about it as a new thing, but I should think about it basically the way it would be with the regular old flu, that where we are now is comparable to something we know before in terms of the kinds of risks we would take when we operated in regular life?
Look, I think that's right. People get uncomfortable when you start comparing the rate of death and the risk of COVID to flu because of some of the comparisons that have been made in the past. But I think for most consumers who need something to anchor against, I think that's a fair assessment that if you're fully vaccinated against COVID with one of the Western vaccines, your risk of having a bad outcome from COVID is about comparable to flu and maybe less because the vaccines for COVID are more effective than the vaccines for flu. So I think that's a reasonable way for the average consumer to anchor their thinking about COVID right now. Again, the only residual concern I think a fully vaccinated person should have is, are they themselves immunocompromised? I mean, if you have a chronic disease that makes you more vulnerable, you'll know that, and the vaccines won't be as effective for you. And are you going to be around people who are immunocompromised? And there you want to be more careful. That's where I would still exercise some caution. But outside of those circumstances, I think we can get back to doing normal things right now against the backdrop of a summer when prevalence is going to decline very quickly. I talked in the outset about 10 cases per 100,000 or 5 cases per 100,000. We're dropping about 1 point every 2 or 3 days. So by the end of the next 2 weeks, most of the country is going to be around 5 or maybe a little bit more. It's going to be quite low, the prevalence.
When you look at the map of places that have not had a lot of people getting vaccinated, do you expect that those will be in the future the places where we might see some occasional flare-ups between now and the next big stage of this?
I think that's probably right. And as vaccine effectiveness perhaps declines as we head into the fall and the winter for people who were vaccinated a full year ago, I think we're going to have to look at the data closely on that, how much of a decline you get in protection. But that's a long ways off. We'll worry about that in the fall and the winter. I do think we're going to have to contend with COVID again this winter, and we may have to re-implement mask ordinances in certain settings where we have outbreaks, or even close schools in certain settings. But I think it's going to be much more reactive. We're going to be reacting and putting public health measures in place based on measures of spread and not these sort of widespread ordinances that we have right now. I think we need to start lifting these things as the situation improves also to demonstrate that we can do that and that we maintain our integrity and our ability to re-implement these things when we have to. The public has to trust that public health officials are going to lift these restrictions as quickly as they put them in place as the conditions improve. And that's probably partly what's holding back the economy right now. People are not going back to work, not just because of the benefits. I know there's been a lot of talk about that, but also because they're being told they have to wear masks and still have to exercise cautions that probably in many parts of this country you don't have to do. You look at San Francisco, 20 cases a day, more than 70% of the population vaccinated, very good testing in place. They don't need mask ordinances indoors anymore, and certainly not outside.
All right, Dr. Scott Gottlieb, we really appreciate you every week. Thank you so much.
Thanks a lot.